So today I'll be talking about proper running mechanics. So I'll start off with a brief slide about some common running injuries, an overview about what to look for at each of the joints when you're running, so the pelvis, hip, knee, and ankle, as well as when you're doing a running analysis, when you're looking at someone run, what you want to see from the side view as well as the posterior view. So I have here listed the different characteristics of running, and I'll dive into each of them. Okay, so here are the most common running injuries, so patellofemoral pain syndrome, Achilles tendinopathy, as well as IT band syndrome. And while I talk about various running mechanics, I'll talk about how you run can actually predispose you to certain types of injuries. So overview of mechanics. So there's 4 phases of running. You have the impact phase, the drive, which is like the push-off, the recovery, and the leap phase. Your pelvis, when you're running, is essentially a bowl of water. You can just imagine it being filled with water, and then when you run, you don't want to tip it too far anterior or posterior, so it should be neutral when you're running. And really, the pelvis is like the middleman of everything. It really determines your trunk alignment as well as your lower extremity alignment. Next, we have the hip joint. So I like to think of the hip as the slingshot. So your hip is truly the primary mover of running. It shouldn't come from your knees or your ankles. It should come from your glute max. And that's because when you're running, as you take a step, you have your glute max contracting here, allowing you to take a long stride forward. And then as you bring your leg forward, it shouldn't come from your hip flexors. It should come from the recoil of the glute max. So really, it all comes down to the glute max. And if your glute max isn't strong, then your calves are going to compensate, for example. So again, your glute max is like your rear engine. It's really important. So here's just a short video. It's like 12 seconds. But it really emphasizes how important hip extension is because it's what drives you forward. You can see here as they pull their leg forward, it's not going to come from the hip flexors, but from the glute max as it recoils. So that's something to look for. So again, big takeaway from the past 2 slides is that if you have a strong gluteus maximus, you're going to have efficient running, a good recoil to bring the leg forward, as well as a long stride. Okay, next we have the knee. The knee is tied to good hip mechanics. So if your hip alignment's off, your knee is going to be off. And it's really important that your knee goes along for the ride because, again, all the movement should be coming from the hip because your glute max is your primary mover. And then next you have your ankle. Your Achilles is an assistant to your gluteus maximus and your calf, so it's helping with the spring. But again, all of it goes back to the hip. And then again, your ankle is going along for the ride. So out of the past 4 slides, your hip is really important for propelling you during running. And if your hips aren't strong, then everything else is going to compensate down in the chain. And those aren't meant to compensate because they're a lot smaller muscles and joints. So what to look for from the side view. I'm going to go over the foot strike, the foot inclination angle, how much knee flexion you should have during mid stance, how much hip extension you should have during late stance, as well as the trunk lean. So whether you want to be a forward trunk lean, extended, or somewhere in between. So the foot strike is the area of the foot that first hits the ground when you're running. So you can either have a heel strike, which is a rear foot strike. So that would be C. You can have a mid-foot strike, which is landing basically the entire foot landing like this. And then you can have a forefoot strike, which is landing on your toes. So you're always running on your toes. Your heel never actually drops down when you're running on your forefoot. So with a heel strike, I'm just going to compare the heel versus forefoot strike. When you land on your heel, your center of mass is very posterior to initial contact. So you can imagine when you land with the heel, your leg and your foot stop instantly, and all of that force is going vertical. Not much of the force is being distributed like horizontally. It's all going up to your tibia and your knee. And I like this picture because it really emphasizes how much vertical ground reaction force is actually going up your extremity. And you can see here too that with the heel strike, your foot is literally sticking out so far that your center of mass is just so far behind. So this isn't an ideal position for shock absorption. We also have a forefoot strike, so that's the opposite. If you can just imagine landing on your toes, your knee and hip are more aligned above your foot, so your center of mass is more parallel and closer to your initial foot strike. And the load is distributed more evenly. So compared to the heel strike, there isn't really an optimal position for your knee and hip to absorb the load. Compared to if you ran on your toes, your knee is in an open pack position, your hip is aligned over your ankle, it's able to absorb the shock easier. So that's the difference between a heel strike and a forefoot strike. And again, this is, you can just see like how much little contact is with the ground with a heel strike compared to a forefoot strike. And then also when you're running on your forefoot, you can just imagine all of your weight is propelling you forward. Instead of with a heel strike, your weight is back here. So really, when you're running with your forefoot strike, it's a lot less, I guess, shock going up your leg. So what the research has found is that the impact force is actually a lot greater with a heel strike compared to a forefoot strike and a midfoot strike. So the forefoot and midfoot strike are actually the same. And that kind of makes sense based on the mechanics of what I talked about before. They also found with the study that runners with patellofemoral pain, they actually had reduced pain levels when they transitioned from a rear foot to more of a forefoot strike, so running more on their toes, which again makes sense because if you're landing back here, you can just imagine how much stress is on your knee compared to if you're landing more on your toes, the moment arm is a lot shorter, or the amount of torque acting on the knee. They also, on the other hand, forefoot strikers, so landing on your toes, those runners actually had a higher plantar flexor and Achilles tendon force compared to rear foot strikers, so landing on your heel. And that's because your heel never hits the ground. You're always on your toes, your calves are always being activated, and your Achilles is always being compressed. So that's what they found. So the bottom line is that there isn't really a correct way for a foot strike. It really depends on the runner. So they found out that if your patient has knee pain, maybe try suggesting a forefoot strike, or if they have more of Achilles problems, maybe a rear foot strike. But it truly depends on the runner. I tend to run more with a rear foot strike, and it actually reduced my pain a lot too when I was running cross country. Okay, so that was the foot strike. Next we have the foot inclination angle, and that is the angle between the sole of your foot and the ground. And this is largely dependent on what type of foot striker you are. So they found out that if you had an increased foot inclination angle, so basically landing more with your heel first, you actually had a greater knee extensor moment or torque, greater shock absorption at the knee, and a higher vertical ground reaction force. So that's what they found with those who have a greater angle here. How much knee flexion? So we went over foot strike, foot inclination angle. Now we're going up to the knee. During mid stance, so you should have about 45 degrees of knee flexion. And that's important for shock absorption. And they found out that runners with patellofemoral pain actually had less knee flexion during mid stance. They had more of a stiffened knee. And that kind of, you can just imagine when your knee is more bent, it's in an open pack position and able to absorb the shock better compared to when everything's just stiffened up. Next, I looked at trunk posture. So when you're running, do we want to run with a forward trunk lean, maybe more extended? So they had a study of 24 rear foot strikers, and they had them run with a self-selected trunk posture of flexed or extended. And they found that those who had more of a forward trunk lean had decreased patellofemoral reaction force at peak stress, so they had less knee stress. They also found out that in a flex condition, their knee extensor moment, or the torque, was also decreased, and the opposite was for the extended condition. So the bottom line here is that your trunk posture really has an influence on your how much patellofemoral joint stress you have. So the more flexed you are, again, you don't want to be super flexed. They said around 12 degrees. The more flexed trunk posture you are, the lower peak patellofemoral joint stress you have. And that kind of makes sense with how we teach people how to go up and down the stairs. You don't want them to be so upright, you want a slight forward trunk lean. So the same thing goes back to running. You want a slight forward trunk lean. The next last part of this is hip extension. So you really want maximal hip extension when you're running because, again, that's your glute max and that's what drives your running and propulsion. You want to make sure that when you're running, your hip extension isn't coming from your anterior pelvic tilt or your lumbar extension. It should come from true pelvis on femur. If you compensate with your lumbar spine or the pelvic tilt itself, you're going to compensate with your calves and Achilles and plantar fascia. So other places are going to get the shock that we don't want them to get to. So in here you can see, this is just a picture I saw online, but this patient doesn't really have true hip extension because of the anterior tilt here, as well as slightly extending from the lumbar spine. So I looked at the relationship, this is kind of to wrap up the side view, between hip extensor strength and trunk posture. So again, it's all in the hips, and they found out that patients with decreased hip extensor strength actually ran more with the upright posture, probably to keep the glute max in a more, not so lengthened position, but more of a shortened position to contract because it was weak. So since they had decreased glute strength, they ran more with the upright posture, and then as a result, they had increased knee extensor torque at their knee. So really, everything from your hips can affect your posture, how much knee stress you have. So it's really important that we look at the hip when you're running and how much strength you have. Okay, so that was the side view. Now we're going to go over the posterior view. So we have the step width, how much heel eversion, heel lips, knee window, and pelvic drop, as well as trunk rotation. So trunk rotation can be seen from the side as well as the anterior view. So step width is the medial to lateral distance between each of the mid-heel at initial contact. So you don't want your right and your left leg crossing. That would be like scissoring gait or the crossover sign. And they also found that in runners, if their peak hip adduction and rear foot eversion angles actually decreased. So the amount of angle here actually decreased when they tried to increase their step width from narrow to a more wide step width. They also found that runners with patellofemoral pain syndrome and IT band syndrome had a 3-degree larger hip adduction angle than healthy runners. Very small amount, but that was just a study that I looked at. So how do we correct step width? We can tell the runners to run with a greater step width. They actually found that in walkers who increased their step width, they had greater glute med activity. But that's not really correcting the problem, and a lot of researchers are all about the top-down approach, so going back to the hip. So strengthening the glute med. Okay. And then heel eversion. This is important because for absorbing shock, so how much pronation is needed. So when you are landing on your foot, you want pronation up until mid-stance, but after that you need your foot to supinate to prepare for toe-off. And runners who are overpronators, so overpronating past mid-stance, they actually had increased tibial rotation, internal rotation, which could lead to knee valgus, hip adduction, just everything up the chain. And then also it can increase stress at your tibialis posterior as well as your soleus, because your soleus is also somewhat of an inverter too that prevents overpronation at your foot. So overall, there is another study I looked at. Individuals with patellofemoral pain syndrome actually had increased pronated foot posture as well as increased midfoot mobility. And a lot of studies out there are looking at giving these runners orthotics to address that, but again, that's not really fixing the problem. And a lot of researchers are now moving towards the top-down approach, which is focusing on strengthening the hip, because again, your hip is going to determine your lower extremity mechanics. So they're all about the top-down approach. So heel lips. This is something I learned new from this project, especially since, me and my friend both have a medial heel lip. So it's basically the angle between the plantar surface of your shoe at initial contact and then at maximal rotation. So this would be a medial heel lip because your heel is medial to your toes. A lateral would be the opposite, so your toes are medial to your heel. There isn't much research on this topic, but they have found that The medial heel whip is a result of overpronating when you're running. Because if you kind of imagine it, if you're overpronating and then you don't actually supinate, your foot is going to be in that kind of pronated position when you toe off. And then they found out with another study that people have about 5 degrees of that whip, either medial or lateral. The next is the knee window and pelvic drop. So we want to look at how much space is in between the knees, and we want to see a square or a rectangle. So from the hips aligned to your knees, it should be a rectangle. Here it isn't really a rectangle. You're seeing a little bit of a hip adduction, and then you also want to look at how much pelvic drop you have, and I have a lot of pelvic drop. So basically you really want to control your glute med, so making sure it's eccentrically contracting so you don't get that contralateral pelvic drop. So what do you need? You need hip stabilization. So it all goes back to the hip. So strengthening your glute med, your hip external rotators, making sure that they're not only strong, but they can actually use it when they're running. And again, another study found that female runners with patellofemoral pain syndrome, they actually had decreased hip abductor and external rotator strength. So making sure that they not only have the strength, but they know how to use it when they're running. And the last is trunk rotation. So trunk rotation comes from not your lumbar spine, but actually your upper thoracic spine. And there is a counter pelvic rotation as your chest moves forward, and then your pelvis actually moves this way. So as you take a step, your trunk moves to the left, in this case, and then your pelvis moves to the right. And it's important for some pelvic rotation because that enables the hip to lock and support your body weight when you're on one foot. So you do want some pelvic rotation, you just don't want it so obvious where you can see it. Okay. And then I kind of wanted to talk about your arms a little bit. So the study looked at how having a low arm drive, so running very low arm, so greater than like 100 degrees, they found out that runners who run with a very low arm drive tend to be more kyphotic when they run. And as a result, your upper thoracic spine isn't able to rotate as well because when you're kyphotic, the segments are now flexed, and the upper thoracic spine can only rotate best when it's extended, when the segments are extended. So since when you're more kyphotic and your upper thoracic spine is flexed, now all the rotational forces are taken up at your lower thoracic and your lumbar spine, which could lead to back pain. So telling your runners or that a forward trunk lean is good, but making sure they're not getting at the thoracic spine. Because again, your upper thoracic spine is meant to take up those rotational forces and help you with propelling with running. So, so how to optimize trunk rotation. You can extend or be more upright at your thoracic spine so that your upper thoracic spine can take up that rotation. You can also tell your runners to run with the elbow flexion from 90 to 110 degrees. So not so much of a low arm drive, which you'll see with a lot of runners. And again, this is just a diagram showing that the upper thoracic spine is meant to do a lot more rotation compared to the lumbar and lower thoracic spine. So you really want to look at their thoracic spine posture. And then just like a little fun topic about barefoot running. Barefoot running is kind of becoming more popular in research, and barefoot running, they believe, is a more natural way to run because we weren't meant to really have shoes, people think, and it's also good for minimizing injury risk. They found that people who run with shoes or shod running, since there's so much cushion at their heel, they perceive their heel as being very supported, so they tend to run more on their heels. So they had a study. They had 23 runners in either running with barefoot or shoe conditions, and they found out that those who ran with shoes had more of a rear foot strike, so running on their toes, compared to the barefoot conditions, they had more of a forefoot strike, so landing more on their toes. So that was just a quick study, but again, other studies say that barefoot running is good in the short term, but not good in the long run. So it's highly controversial, but it's becoming more researched now. So the main takeaways is it's all in the hips, because your hips really control what happens at your lower extremity as well as your trunk. And what you want to see, again, like I mentioned before, is the rectangle. So pretty much all of these runners, maybe except for this lady, they all have some type of like acuteness here, acute angle instead of a 90-degree angle. So that's something you really want to watch out for. So both in those pictures and then also with the tilting or the pelvic drop, as well as over here. So just to review, so we went over the side view and the posterior view. So these are just, again, there's so many things to look at when you're running, but I just decided to choose about 5 from each section. So again, we had like what to look at: the foot strike, the foot inclination angle, knee flexion, hip extension, as well as a trunk lean. And then also with the back view, so looking at your step width, the knee window, the heel whips, pelvic drop, as well as how much trunk rotation you want during running. And then those are my references. Yeah. Yeah. Does anyone have any questions?
In all your years of running cross-country, did they ever analyze you this way?
During my years of cross country, did they ever analyze me this way? In a way, yes. My coach, my arm swing was very low, so my coach always told me like hip to nip, so you get that 90-degree angle. But he never analyzed me particularly through all these different methods. But he did correct my foot strike, because I was if I look back at my old running pictures during races, I was very much a heel striker, and I had basically shin pain and knee pain like the whole season. But when I transferred to more of a forefoot strike, my pain like went away. So like he was really into trying to correct my foot strike that way, and then my arm movement.
So then on that note, do shoes make the kind of shoes you put a runner in make a difference?
I think they do to a certain extent, but I think we need to focus more on what's going on up in the chain, because if it's actually due to something at the hips, then fixing the shoe won't do anything. It's just going to fix the posture of the foot. Yeah. Mm-hmm. And a lot of research is like, we can't just do orthotics anymore. We have to address more proximal.
The talk talk earlier, but I missed the running without the shoe. So what's the barefoot?
Barefoot running is actually, people who run barefoot actually run more on their toes compared to their heel. And it's the perception of when you run with a shoe, like all that cushion there, they tend to be like, oh, there's a heel cushion there, starting to land more on my heel. And yeah, I remember during cross country too, when we would do a lot of barefoot running actually at the end of practice when we did strides on the grass. Yeah.
For assessment, is it still okay to assess people on a treadmill, or should we go out on a hallway more often now?
Yeah. Oh, is a treadmill running a good assessment of how people run, or should we do it outside? And the research has says that treadmill running is actually a good representation. I have it up just like. Okay. Treadmill is a good representation of running on land. And they compared 20 runners who ran on the treadmill versus the ground, and they found out that the overall symmetry was 0.94. So perfect symmetry is 1.0. So overall, it was pretty much the same. And then the most, I guess, differences, I didn't look too much into it, but the transverse plane movements were different between the treadmill versus the land running. But overall, the conclusion made that treadmill running is a good representation of ground running.